My name is Saija Imrao Borkar. Today I have discussed about the ethical consideration in clinical research. It is the studies are the conducted responsibility with respect for human dignity, rights and well-being. Then the details discussion of key ethical principle and consideration. First one is the respect for person, informed consent. The participant must provide a voluntary, informed, and the written consent after being adequately informed about the study's purpose, procedures, risks, benefits, and their rights to withdraw at any time. In which the autonomy. Researchers must respect participants' decisions and protect vulnerable population. Example is children, elderly, mentally inaccepted by seeking consent for legally authorized respectiveness where necessary. In the benefits and non-malefics, in which the risk benefit analysis, researchers must minimize risks, that is the physical, psychological, or social, and ensure the potential benefits outweigh the risks. Then the safety monitoring, implementation of data safety monitoring boards or other mechanisms to identify the address adverse event. Then the justice, in which the selection of participants, avoid the vulnerable populations or burdening specific groups, ensure fair distribution of the research benefits. Then the assess to results after the study participants or their communities should benefits for the outcomes. Example is the assess to successful treatments. The scientific validity and integrity sound study design, in which the research must be methodologically robust to ensure results are reliable and scientifically valuable. Then the avoidance of misconduct, in which the researchers must avoid practices such as data classifications, fabrications, and plagiarism. And then the confidently and privacy data protection, in which the participants' personal data must be protected using the inscription, anonymizations, or the pseudonymization. And then the ethical use of data, in which the researchers must use collected data only for the purpose agreed upon in the consent form. In the justice, fair selection participants, recruitments should be ensuring that no group is disproportionately burdened or included without justification. Benefits and risks should be distributed fairly across all groups. Then the assess to result, after the study, participants and society should benefit from the finding, especially if they pretend to initial healthcare interventions. Then the independent review ethics committee, in which the institutional review board or ethics committee must evaluate the research proposals to ensure compliance with ethical standards before the study begins. Then the transparency, the review process should be free from conflict of interest. Then the post-trial obligation, provide participant access to beneficial treatments identified during the trial. Disseminated finding to the public, ensuring transparency about risks, benefits, and outcomes. Then the culture sensitivity research should respect culture norms and values of the community involves, engage with local communities to understand their concern and seek their input in the study design. Then the awareness to legal and regulatory standards, comply with the national and international regulation governing clinical research, ensure proper documentation and records keeping for accountable. Thank you.